Hello students, we are back with another topic in the PHYSIObrid series. Today I am going to demonstrate how to perform some of the special tests on the shoulder joint. Special tests are used as part of a detailed clinical assessment and as an adjunct to history taking, clinical observation, physical examination and investigations. As physios, special tests guide us to diagnosis and treatment. Today, the test that I am going to perform is Yergasons test. Yergasons test is performed to identify any tendinopathy of the long head of biceps as well as superior labral anterior posterior lesions, also known as SLAP lesions. Primarily, this test was designed to check for the integrity of the transverse humeral ligament which holds the biceps tendon in the bicipital groove. The transverse humeral ligament lies in the anterior aspect of the shoulder between the greater and the lesser tubercles. To perform the test, the patient can be in sitting, high sitting or standing position. Here we have Mr. Ajay who's in high sitting position. To start with, the patient's elbow is flexed to 90 degrees, forearm is completely pronated and the elbow and arm is stabilized against the patient's body. With one of the hands, stabilize the patient's elbow and with the other, at the patient's distal forearm, instruct the patient to supinate the forearm against resistance. A reproduction of the patient's pain in the anterior shoulder region is indicative of a positive test, in which case biceps tendinopathy or a SLAP lesion is suspected. A clicking sound or a popping of the biceps tendon, if observed in the bicipital groove, that indicates a subluxation of the biceps tendon due to a tear of the transverse humeral ligament. As a variation to the Yergasons test, we can ask the patient to perform external rotation at the shoulder, which is resisted along with resisted forearm supination. To do this, with one hand, palpate the bicipital groove, which lies over the intertubercular sulcus, and with the other hand, resist the supination along with shoulder external rotation. As the simultaneous movement of forearm supination along with shoulder external rotation is a complex one, we encourage the patient to do this without resistance at first. We just learned how to perform and use the Yergasons test. This test, along with many other special tests, can be used in the differential diagnosis of tendinopathies at the shoulder. I will show you how to perform the other special tests in separate videos. Thanks for watching.